what we're advocating for. The other thing is about focusing on the health minister, because the engagement of health in the context of climate policy is new. It's the frame that we can prosecute as a sector, and that there's previously been an unwillingness to engagement. So it's about sort of it's a bit of a sort of public narrative kind of approach, really. I guess one of the other reasons is that, as my last slide said, the campaign is currently financed by and being run by individuals and volunteers. So, with some capacity, there could be a lot more work go into outreach. And I certainly envisage that once that policy proposal is developed, and sooner if possible, that there are other, representatives from other sectors and portfolios engaged as well, because I think absolutely, when that framework is developed about what it would look like, that's when the real work begins of engagement, right across the portfolios to say, well, this, has leakage into all portfolios. But any ideas about, key people that you think would be good for us to engage with, as early as possible, very happy to hear them, or, get involved and help support people to do that, and to the extent that we have capacity, I think we'd be pleased to do that.
G'day, Martin Laverty from Flying Doctors. Can I address this question first to Steve and then to you, Fiona? Steve, you, I think, rightly suggested when the value set of the audience that you're trying to change perhaps doesn't align with your own, you're going to have a real struggle in challenging the value set. Fiona, it occurs to me at the moment with the current government, the value set in responding to your campaign is going to be a really interesting one to change. But you rightly pointed out earlier that ACRA, at the right time in the political cycle, did have a responsive government, so the political cycle does change and allows that opportunity to plan for when the values are aligned. But Steve, if changing values is so hard, where else do you invest your energy so that right now we as the Social Determinants of Health Alliance struggle with this government who perhaps doesn't embrace determinants of health in the way that they might? So if we can't change their values, what lever? Is it cost benefit? Is it advocacy? Or which other is best likely to resonate with this one? And Fiona, you might reflect on that as well. My suspicion is that the current minister, whilst I don't read her mind, perhaps won't embrace this campaign, won't have the values that would embrace this campaign right now. But in a parliament with a majority of one, that time might be not that far away where there'd be a much more responsive attitude.
Thanks, Martin. So the word values is used differently in different communities. But a doctor talking to somebody in their care who smokes a lot doesn't necessarily start off by saying, you've got to change your core values. They do say these are the consequences of your behaviour, and I think you should really think carefully about changing your behaviour so that your behaviour aligns with your values. And I think by analogy you could say almost exactly the same thing to the current government. There is a value proposition for you to adopt the things we're talking about, but what you're doing at the moment isn't consistent with that. So how do we work together to develop a shared space where you put some values on the table and I put some values on the table and we come up with something we can live with? So I think Fiona and my presentations are quite complementary, but I would be starting in a different place. So, the world's a big spot that can accommodate the two of us, and I'm very glad Fiona's saying the things she's doing. But I would be looking for something where people can go to an event, they can have a really good engagement with people who are different to them, and I imagine, for me, the success test is after the event, people go to 3 or 4 different barbecues around the city, and they're all talking about what a great event it was and how we should be doing X. But then their next sentence at each barbecue is quite different. We should do X because. And when they explain why they think we should do X, the barbecue in the leafy, expensive suburb is saying a different story to a barbecue somewhere else in town. Because what we want people to agree on is what are we going to do together. And to bridge across governments, if it's something that requires 6 or 10 years of committed action, you're going to need more than one story. So part of what I do, I teach a little bit at ANU, I try and unteach things. You know, public policy has taught us agree goal, develop options, assess goals against blah, blah, blah. And frankly, if you've got a problem where everybody agrees the goal, you know, you don't need a public policy course to teach you how to get there. So I think we need to be a bit more open to this notion of overlapping consensus, where people who are different to me or different to you agree on what we want to do together, and there is some baggage we're just going to have to park to next time because we're not going to agree on that. So that's where I would be coming to it. But you know, the health space, there's huge amounts of things to agree on, and politicians may decide to do something because of fear of consequences, but when they're telling the public what they're doing, they're going to want a positive story. So we need to, you know, fear and hope need to live in the same tent.
Yeah, I totally agree with fear and hope. Well, a couple of things. I guess, I mean, the health frame is a very useful one. You know, health is a really big issue when it comes to elections, and I think it, you know, swung some seats in the recent election. So I think the fact, you know, communicating about climate change as a health frame is new, and that's one way to get some of the cut through. But I guess, you know, there's a couple of things about this campaign. One is that it's policy consultation and a genuine effort to understand what that sort of policy response needs to look like. But it's also using that to, you know, build the social movement and the, you know, advocacy movement for change. So in terms of how this government will respond and values, I don't really see a huge amount of difference, to be honest, whether it was the coalition or the ALP elected. I mean, the ALP might appear to be more open, but I think they probably do equally little. So I think, you know, moving towards bipartisan agreement around this issue really important. I'm prepared to be surprised by the coalition, and I hope that's the case. And as you say, you know, with a slim minority, we may see some sort of unexpected responses on issues. But we really need to build that sort of political movement to create positive pressure to get the response. And and just going to the, you know, about values and talking about cost-benefit analysis, whether that's a frame in which to use. I think that there are very powerful stories to tell about the opportunities for health from climate action in terms of the economic savings. So we haven't done this work here in Australia, but I'm hoping that through the course of this campaign that we will generate enough interest that somebody will fund the project that we have been trying to get somebody to do for some time, which is to really look at different emissions reduction scenarios for Australia and say, okay, so if we had these different strategies, what would the health co-benefits be associated with that? What would be the economic savings associated with the avoided ill health and productivity gains from those scenarios? Because what happens is when you do look at that, and there's been some really useful work done overseas, both in the UK and in the US, and one particular study I like from the Massachusetts Institute of Technology that was done in 2014, and they looked at different emissions reduction strategies, specifically to look at the savings for healthcare associated with them. And what they found was that they deliver enormous benefit cost ratios, as high as 10 to 1 in the case of a national emissions trading scheme, because of the changes that it would drive in the energy sector towards energy efficiency and renewable energy and away from fossil fuel energy, and therefore deliver air pollution gains and reduce cardiovascular disease, respiratory disease and cancers. So they found that, you know, that there was a benefit cost of 10 to 1. So you invest $1 million in that policy, it'll save you $10 million in avoided ill health and productivity gains. You know, so there's a win-win-win right there. You've got emissions reductions, you've got health gains, and you've got economic savings. So it completely blows out of the water the argument we can't afford to act on climate change. So I think, you know, some of the sort of narrowing sort of gaps in between, you know, economic productivity now and with emissions reductions, I think if you take into account the externalities associated with emissions now and the opportunities from reducing emissions into that equation, the economic argument would be much, much more powerful.
Any other questions, thoughts? Yes?
I'll just follow up, because I've got a bit of a similar question, so I would like it answered in a different way, and I'm a bit more cynical than Martin, I guess. So I'm Kim, temporary CEO of the National...
I'm very cynical.
Yeah. Of the National Health Alliance, and so I guess, you know, we've had lots of discussions internally. We've got a few of the team here about, you know, how we discuss this issue even with our council of, you know, 40 mainly rural health professionals. And I guess, going back to something Stephen said, which I really liked, is, you know, the doctor walked into the room, he said you've got cancer, and he did leave. Like, that is actually what's happened. And now we want to walk back in at the next appointment and say, let's discuss your treatment options now. But even talking to our Alliance of Health Professionals, I think they're going to want to go and discuss with us and discuss with each other the science of climate change. You know, if we try and raise that as an organisation, I think that's problematic for us as a peak body, because I guess what I'm hearing a little bit is we've got a room full of people who think that climate change is important, and so then we want to talk about it in a health context. But for people who are not convinced of the science of climate change, how would we talk about it in a health context without it being a big conflict? Because on the very first slide that you put up, Fiona talked about earthquakes and cyclones, and I don't think people are ready for that.
I don't think I mentioned earthquakes. Natural disasters,
yes,
perhaps.
sorry, natural disasters. and so if that's going to be our argument, is that our argument about why we should deal with climate change from a health point of view? I'd love to have a really coherent argument that we can then start talking about what we need to do about it. But are we ready to do that?
Who are you directing your question to?
All of the panel.
I think there's lots of opportunities, and so, and partly because of the worldview stuff, I will often talk about climate variability and change, and the unarguable proposition is Australia does not manage existing variability well enough. Okay, so we have room, even if there's no trend climate change, the possibility that climate change might happen strengthens the case to fix how we currently manage variability. And so I think it would be easier to get a broad church where climate change and, you know, good public health planning and more joined up government all come together, and just what are the shared things that there is sufficient reason to do this if you only care about public health, and there would also be sufficient reason to do the things that are listed if you only care about climate change. And so you're just broadening the base, which I think is really helpful. But for me, there's a wider context that there are three big things going on that I don't think we pay attention to enough. So the first is a big transition to a crowded world. Okay, so and there's lots of different ways of talking about it. You know, one of my Gold Star authors talked about moving from the cowboy economy to spaceship Earth. You know, just everything's connected now. What you throw away is going to be in the food chain later on. So that's one transition. The world is just getting more crowded. We need to be more careful how we nurture the planet and manage it. The second big transition that we're seeing right across at least high-income countries is a transition from silo management to joined-up government, okay? Which is just a recognition that we've had 30 or 40 years of doing silo management, and all the things that work in silo management are now working, and everything that's left over doesn't. And so you need to shift your paradigm away from deep expertise in one thing to a more inclusive approach. And public health is right at the forefront of that. So public health knows how to do that stuff and to connect it up. And to have a sensible conversation about why don't people ride their bikes? It's because the lights are crap and they don't want to get run over by taxis. You know, that's why I don't ride at night. So how do we get healthier communities? We fix the lights, and we might do an education campaign for taxi drivers. But so you've got to think about the system as a whole. And that's reflected a little in the third one, which is just democracy has thinned out in high-income countries. And I think that's, again, this is a very long conversation involving at least 2 bottles of red. But part of what's happened is we've got this idealised view of what happened after World War II and the long boom where Keynesian economics worked, and we invented vacuum cleaners and a whole bunch of other stuff, and it no longer delivers. So that was a situation where at the beginning of that, high-income countries were not high-income in the sense they are now. And now, nobody dies, no kids die of infant mortality of poor nutrition in Australia because of economic reasons. And so everything now is about social position and relative and much more complicated. And the old ideological framing of, the party in favour of capitalists and the party in favour of workers, that doesn't provide a narrative that works anymore. And coinciding with things like, the rise of terrorism, which that's a different conversation, and the rise of climate change. Now most people under the age of 40 don't think democracy is a very good system anymore. Okay, so when you ask them, about half say no, they don't think democracy is the best way of organising ourselves. They can't nominate what is better. So we've got this real loss of identity and sense of purpose and what the political process is supposed to do. And so that's where I think, for me, a big attraction of the notion of organising, even though it sounds like a fight, and I try and pretend we don't have to fight, we can just all find things we agree on. That process of bringing us back together and connecting with people and actually listening and trying working out what we want to do together, that's a hugely constructive process to give people purpose and identity and help us together create better solutions, because going back to silo government bureaucracies don't have the capacity to do it, and the political situation is not very conducive, so if it happens by luck, and I would rather get a bit more systematic.
One of the things health professionals do routinely is to engage with risk. And if you go in with symptoms to the doctor or a nurse practitioner with symptoms that look like a cold but could be, there's a 1% chance it's pneumonia and a 0.01% chance it's malaria because you've been to Africa not very long ago, one hopes they're going to rule the 2 worst things out. And they're going to act either to find out more information or assume the worst in their treatment of you. And in doing that, I think there's a sort of similar approach with climate change. So even if you don't believe the science of climate change, I think the recognition that there are a number of experts that are entirely certain about it maybe is parallel to different specialists having different opinions about what's causing a series of symptoms in a patient. And it's important then, I think, to phrase it as a potential risk that needs to be dealt with, even if it's not a certainty. So that could be one approach.
If I could just respond really quickly, I have spoken at National Rural Health Alliance Council Fest several years ago, and I don't remember that being particularly controversial. And I would just really encourage you to, frame it in the context of the impacts on climate change on rural and remote people. I mean, I've spoken at CRANA conferences, at SARA conferences, those who are members, ANMF, they, consider the health impacts of climate change to be a really important issue, and they're very concerned about it, and they would like, guidance and support to figure out what to do. I mean, it is impacting, people's work, droughts and farmer suicides and changing seasons and declining food productivity, all creating pressures on people in rural and remote Australia, on Indigenous communities and so on. I would, encourage you to kind of approach it in that context. There's lots of amazing people, in Canberra who are climate and health researchers who can come and talk about it from that perspective and, work with the Alliance to help develop a position that, you know, suits all of the members. But I'd be inclined to think a lot of them want to get on with it, really.
This have to be the last one, I think, before lunch.
It'll be a very quick observation and comment. Katherine Nielsen from the National Rural Health Alliance. I was particularly interested in the work you're doing with the National Outlook and looking at the parameters of things that SIRO understands, has research on, that feeds into that, which you acknowledge were largely resource-based. And the capacity to do exactly what you're talking about, Fiona, to feed a health data framework into that, which when you showed those maps of Russia and Canada being the areas of the big, mentally, this is how we view climate impacts in rural and remote. Rural and remote are clearly where the biggest hurt is going to be felt, according to all the research that's happening. Is there a way that a lever we could help push to assist that research to be highlighted, to show, to overlay the vulnerability mapping, as you were, of rural and remote health and climate change with what you found about, because there were extraordinary stories to me. When I read that first, I went, oh my God, actually here we have the proof that you can use the water resources we have and still not lose money. It's not a story that's being told in Australia well at the moment, and no, that's new. You know, to me, what's the bleeding obvious with if we act on climate change, especially in areas of greatest vulnerability, how we can get clear data around that will help us tell that story.
Yeah, so there are certainly, I think there'll be opportunities to build that in better, and there are clearly people who are working on these things more specifically. For me, part of the entry point is we always talk about risks and opportunities. So, you know, savanna burning, improved ecotourism, carbon plannings. There's a bunch of opportunities associated with responding to climate, as well as a bunch of threats from climate change. And then there's a bunch of things which is just, you know, we could really muck this up. You know, so some of our research shows very, very large areas of Australia could change from current farming techniques to other ones. That's a really big social challenge to talk through, and to, you know, you're going to need a lot of cups of tea for that one. And so I see these as coming together and needing both, you know, techie models and stuff, but also on-ground smarts and different views and opinions. So love to talk about that more, or it might tie into some of the stuff for Centre for Social Policy and those sorts of things. So the SIRO certainly is not always going to be the best research option, because we're not always very cheap. But
well, AIHW is starting to map geographically exactly some of the sort of stuff that could feed.
Excellent.
With linked data into that. Do you agree? And the stuff that we're talking to them about. So, love to talk further.
Yep, excellent.